I have a brain injury.
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 You may be asking yourself, what is a brain injury?
A brain injury causes sudden damage to the brain. A concussion is the most common type of brain injury.
Regardless of the cause and source of trauma, brain injuries result in two types of damage. The damage that occurs at the time of impact is called primary brain damage. This can include skull fractures and bleeding. Damage that evolves over time following the traumatic incident is referred to as secondary brain damage. This can include seizures, brain swelling, and increased blood pressure in the skull.
There are two types of head injuries. The first type is open head injury. This can involve a bullet or sharp object entering the brain, which causes damage to specific parts of the brain.
The second is a closed head injury. This is trauma to the brain that does not cause penetration of the skull. This type of injury can cause the brain to knock against the front or the back of the skull.
The leading cause of brain injury is falls with 35%, followed by traffic incidents with 17%. This chart shows other common causes of brain injuries.
It was Halloween 2012. I was 2 classes shy of graduating from Purdue University with a mechanical engineering degree with multiple job offers, just on top of the world. Well, long story short, about 6 weeks later, I woke up from a medically induced coma. I had fallen downstairs.
I've had brain injury for 15 years. This will be 16 years at the end of this summer. For the first place was when I was in college. That's the first time that happened. A brain aneurysm when I was in Columbus and all the way up to Cleveland Hospital. That's where I had my biggest seizure in my brain, where it cut through and I had it taken out. So that's helped a lot, but I still had some seizures.
The incidence of brain injury refers to the number of new cases identified in a specific time period. The prevalence refers to the number of individuals who are currently living with a brain injury in a time period. 3.2 to 5.3 million people live with long-term disabilities that result from a brain injury. This represents 1.1 to 1.7% of the population.
In the U.S., someone experiences a brain injury every 21 seconds.
Because each injury damages a different part of the brain, every injury is unique and presents itself with a unique combination of side effects. Side effects can affect swallowing and behavior, but for this presentation, we have chosen to focus on the physical, cognitive, emotional, and communication deficits that are caused by brain injury.
Invisible physical symptoms experienced by individuals can include dizziness, weakness, headaches, fatigue, and changes in vision and hearing. Physical symptoms that are visible to the outside eye are loss of consciousness, nausea and vomiting, reduced muscle strength, and impairments in movement.
Cognitive deficits can include difficulty with concentration, processing, multitasking, orientation, problem solving, memory, reasoning, as well as attention.
Emotional and behavioral symptoms include changes in experiencing or expressing emotions, agitation or combativeness, anxiety or stress, and depression. Individuals with a brain injury can also experience mood swings, impulsivity, irritability, and reduced frustration tolerance.
Communication can also be affected by a brain injury. People with a brain injury can have difficulty understanding or producing speech, can have slurred or spastic speech, decreased fluency, difficulty with motor programming of speech, inefficient spelling, and difficulty with overall communication.
Speaking, reading, I might get angry. Time that I've had not an epilepsy, but a major problem with my speaking was over at a grocery place. I was trying to buy something, and my talking where is a little different from what I think in my head, and we got to this big fight, and in the end I didn't get kicked out, but I had to calm down, and I went to a different line, and that's what I bought my things in the end. So it ended up being fine.
On admit, I was not oriented to most person, place, or time information though I could provide some cues or recognize the correct information. My auditory comprehension was functional for basic daily needs, simple related yes/no questions, but I was not able to listen to moderately complex yes/no questions and answer those accurately. I could follow one-step commands when given some additional cues. Verbally, I could provide simple words and sentences. I spoke at a low intensity and fast rate, making it difficult to understand. At times, I repeatedly used the same sentence when asked for various pieces of information. Word retrieval was one of my biggest deficits I remember.
These are the similarities between alcohol use, brain injury, and drug use, which can make it difficult for police and community members to decipher the difference. Although this is not an extensive list, some of these similarities include altered emotions, anxiety and confusion, drowsiness, and slowed reaction time. There are individual differences amongst brain injury, moderate alcohol consumption, and drug use. Being aware of the differences can help law enforcement and first responders when they encounter an individual with a brain injury. This way, a misunderstanding of drug and alcohol abuse can be avoided. Some symptoms specific to brain injury are difficulty with memory, impulsive reactions, and slowed information processing. This Venn diagram also shows symptoms that are just specific to alcohol and drug use.
While all brain injuries are different, I think it's important to ask if, the history of a person and, when that had happened, maybe they had a brain injury. And I believe it's pretty common with most TBI survivors. Initially, they're not really aware of their deficits. I wasn't. I thought I was going to go right back to school and graduate. Here it took 2 years.
It would be good if we all work together. We're not just, some people's just doing it on their side and someone else is just working on their other side. It's much better if cities, towns, anywhere, you work together. It makes everybody happier.
Just that being in my situation doesn't make me stupid, and a disability doesn't define who I am, and my mind still works, and I'm still a normal person.
Individuals with a brain injury can easily go undetected at a glance because brain injury is an invisible injury. However, people with brain injuries can live normal lives. We hope that this video increased your awareness and knowledge of the many facets of brain injury. We also hope that this encourages you to use emotional regulation in stressful situations with an individual that may have a brain injury.
I am now currently in Denver, Colorado. I was offered a job about a year and a few months after graduating for an engineering job in the construction industry, and I fortunately had to leave University of Cincinnati with their brain injury group.
I graduated college from Thomas More with 2 degrees, and I currently travel around to high schools and colleges.
I'm working again. I will be driving in, I think, a week and a half, which is exciting. You get to go do stuff on your own. I'm so happy. I'm talking to our friends, family, random people, giving high fives, hugs to any people. It makes you a completely different person. You become happy. You become happy. You can see, happy.